We're live. All right. Hello, everyone. In the earlier video lectures, we talked about coding pregnancy and maternal conditions. Now, of course, the next logical chapter is to code the newborns. There's a lot of carryover with this. That again, you have to be clear on what is maternal, what is a newborn condition. It does have the potential to get confusing. You can have a pregnancy complicated by HIV. You can have a newborn baby who is suffering from complications from HIV. So we're going to talk about all that and more starting now. And again, in the same way that the maternal conditions all started with O, the perinatal period, the newborn period, starts with P, as in pediatrics. I'm going to go to slide 3. And again, what do we mean by the perinatal or newborn period, right? What we mean is things that happen in the first 28 days of life. And you can see these things cover newborns affected by maternal factors. It also covers complications of pregnancy, complications of labor and delivery, um, covers prematurity, P05 through P08, disorders of newborn related to length of gestation, abnormal findings on neonatal screening, birth trauma, respiratory and cardiovascular disorders. You can see some more here. This is basically giving you an introduction to how this is all laid out, right? You can see the infections, hemorrhagic, transitory endocrine, metabolic disorders, digestive disorders, integumentary, temperature regulation, other problems. And then at the very end of the chapter, other disorders originating in the perinatal period. One thing to bear in mind is codes in this chapter describe conditions that begin before birth or develop in the first 28 days of life. This is not the same as congenital. Conditions that develop during the perinatal period may exist past the first 28 days of life and can be coded regardless of the age. And we'll get into some of these in just a little bit. And again, these codes are only for use on the newborn or the infant record, the baby record. It's never used on the mother's record or the maternal record. A condition can originate in the perinatal period and continue through the life of the child. So if there's birth trauma and it affects the infant going forward and they're still affected by it, that can continue. And as you would expect by this time in the course, there are a lot of instruction notes that you will see in the tabular. Here we start seeing instructional notes that affect the sequencing, particularly with birth weight and gestational age. When both are documented, birth weight is coded first. These rules are specific and must be followed exactly. And an important thing about this slide is the emphasis that certain maternal conditions are coded here only when they are documented as affecting the newborn. The focus remains on the baby, even when the cause originates with the mother. There's some very specific chapter guidelines that cover the use of Z38 codes. Notice that these are not the same as Z37, outcome of delivery. Z38 is a newborn code. It goes on the newborn baby and it's assigned once at birth. Sometimes children will be born in a hospital in the labor and delivery room and it doesn't have an NICU. It's transferred. The hospital where the baby's born you'll assign the Z38 code. The hospital where the baby is born or is transferred to, you will not. Let me back up on that. The principal diagnosis when a baby's born in the hospital is a Z38 code. The principal diagnosis for a premature infant that's transferred somewhere else where there's an NICU will be whatever the principal diagnosis is the cause for the reason to the NICU. And we'll go over some of these and it'll make some more sense to you. But you suffice to say you're a newborn once only when you are born at that hospital. And that's all I have for you. Thank you for watching. Come back for our next video lecture where we'll get more into this topic about the Z codes, the newborn codes, and principal diagnosis and sequencing. Bye now.